year, and by profession, memang she's a dentist, and I would say that me, being myself, going to her to learn new things, she has a lot of knowledge. And trust me, if you are using Glister, you want to share more with people, this is the correct person that you want to learn from her especially. So, ready? So please, give her a round of applause, guys, to Dr. Vidya to share about oral health for today.
Thank you. MC kita nervous. Please give him a big round of applause. All right, everyone can hear me well? Okay, so my name is Dr. Vidya. I'm here to actually present to you on a very, very important topic today. But before that, all right, I want to express my immense gratitude and also thank you to founders of DVI. All right, late Dr. Aziz and Kak Saleha and second generation FEDC Kak Saleha and Kak Nazli. All right, please give them a big round of applause. And also to my mentors in the business, FEDC, Mr. and Mrs. Low, all right, and my dearest upline and introducer, Diamond, Mintian, and Huyin. Please give them a big round of applause. Okay, so siapa dah gosok gigi? Of course, all of us dah gosok gigi lah kan? All right, so that's not even, that goes without saying, right? So today, I'm not, it's going to be a mix of both what you would have probably learned in your school. You know, ada nurse dengan baju putih, uniform putih datang, you know, like they come and teach you how to brush your teeth, right? Okay, how many of you all experienced that during school days? Yes, it's going to be a mix of that and also a lot of new things, all right? So, yes, let's start. Okay, so I'm going to talk about oral health and let's talk about the basic structures. Do you all know your oral cavity very well? Because if you don't know what is normal, then it's very difficult to know what's abnormal and what is disease, right? So you have to know the basic structures, all right? The gum, teeth, and the tongue, all right? I can't show you tongue here, but I can show you what is the pink structure is the gum, or we call it gingiva, all right? And the white one is the teeth. Yes, gigi. All right? Okay, so yes, pink means it's very healthy. Why this model? Why is the gum pink in color? To show that this is normal. All right? Yes, this is normal. All right? If your gum is, but there can be variations. All right? For example, if you different ethnic, okay, if you belong to a different ethnic and if you have darker complexion, you can have a little bit more, you know, darker pink, and you can have areas where it's more brownish in color, all right? So it's all normal, all right, as long as it's not red, okay? It's not very red, and then it's a sign of inflammation, all right? Thank you. All right, so and then your teeth, all right? Your teeth is so important because we all like to eat, all right? We all, I think that's the only mode of, you know, surviving, right? So we need our incisors, everything from the front till the back. We need all different kinds. They're all not the same, okay? So they all are different in size, they all have different functions, and they're all placed in different areas for different reasons, all right? And then we have the tongue, all right? This one also important because then we cannot talk, all right? So if no tongue, you cannot talk and you cannot taste food as well, all right? So yes, speak, swallow, taste, everything. Okay, so a little fact check, and so how many of y'all didn't know that enamel is the hardest structure in your body? Yes, okay, it's actually harder than your bone. It's more dense and more mineralized, all right? And yet, lubang. So can you imagine how much of damage we have been doing that such strong structure, mineralized structure can actually decay, all right? And humans only have 2 sets of teeth, okay, and what is that? What are those? Your gigi susu and gigi kekal, your baby teeth and your adult teeth. All right. So, and yeah, I like the third point here because this is where the interesting part of dentistry comes. All right. All of us do not have the same teeth. Though they look alike, but we all have, macam our DNA is very different, right? Very unique. So, your teeth as well. All right. So, that's where forensic dentistry comes in. All right. So, whenever there is a murder, for example, all right, whenever there's a murder case or something, that's when a forensic dentist steps in to actually find out how the murder has taken place. All right. Or say there's any evidence of the murderer on the teeth, on the oral structures, all right, bite marks, all that. So just by looking at certain bite marks, you'll be able to actually find who's the murderer, all right? So because it's very unique that way, okay? Okay, so, all right, so macam very, very fact-based, like too much of facts, okay. But it's very important to know because it's very important to also take care of your oral health. If you don't know where we stand now, and then it's very difficult to control, right? So 3.5 billion people are actually suffering from oral diseases, but many of them do not know, do not realize it, all right? 796 million people are affected by gum disease, which is a very, very common disease of the oral cavity, all right? And dental cavities in permanent teeth, okay? Let's not talk about kids, all right? Affecting 2.3 billion globally. That's a very huge number, all right? And 9 out of 10 adults suffer from dental cavities. 9 out of 10, okay? All right? Probably gut health is just 10 out of 10, 9 out of 10, okay? All right, lah. Okay, not that bad. All right, so an estimated 75% of Malaysians are unaware of the need, okay, for oral health care. 9 out of 10 adults have gum disease. Again, 9 out of 10 for dental cavities and 9 out of 10 for gum disease. 7.3% of Malaysian adults have lost their teeth. All right, that means they are completely edentulous. All right, that means they do not have even one tooth in the mouth. All right, and it's very common, but now with advancement and also we are more modern now. We are more we are more aware, right? So that doesn't really happen. Okay, so what are the effects of poor oral health? All right. So what we know is usually this, right? What you see down here, correct? The bottom, gum disease, whatever I've already mentioned, decay, bad breath, tooth loss, and also gum disease. But what many people don't know or not aware is the one on top. Okay? From diabetes, lung condition, strokes, heart disease, and mouth cancer. All right? But I'm not here to scare you to say that if you have poor oral health or if you have, let's just say, a few cavities and gum disease, you are not going to have heart attack or you're not going to be having diabetes. No, that's not the fact. Okay, that's not what we are trying to say. All right. Sorry. Okay. So what we want to establish here and make it very clear is the mouth-body connection. Okay. So can you actually see? I'm sorry that the diagram is actually not that big, but I'll read it to you all. Okay. I'm just going to name all these conditions, and you'll be quite shocked to know that oral health is linked to these conditions. Okay. Alzheimer from the brain, Alzheimer, dementia. Okay, stroke, which is coming from your heart disease, all right? Sorry. Okay, thank you. And then respiratory disease, heart disease, we spoke about it, obesity, all right? Sexual and reproductive health will be compromised, cancer, diabetes, osteoporosis, rheumatoid arthritis, okay? So, these are the facts from American Dental Society, all right? So let's talk about oral health and what's the relationship with heart disease and heart conditions, all right? Like I said, they do not cause heart issues or they do not cause, that means in a relatively healthy person, it's not going to cause like suddenly, you're going to have like heart attack or no, that's not it, okay? But today if you have poor oral condition, all right, which means you will have increased amount of bacteria, right? Very simple. poor gut health, we have more bad bacteria. Poor gum health, poor oral health, you have increased bad bacteria locally, all right? That anywhere in your body, they can travel, all right? Same goes to your gut. So it's very easy for us to understand because we have studied enough about gut health, all right? Similarly, they can actually travel and enter the bloodstream and contribute to the formation of arterial plaque, right? So, and what that cause, what will that cause? Basically, thickening of your blood vessels, all right? And then that will increase your risk factor for high cholesterol, increase your risk for cardiovascular diseases, and then hypertension, and then heart disease, and all that. All right, so the inflammation caused by periodontal disease, the word periodontal means gum and the structures beneath, all right? The supporting structures of your tooth, all right? Supporting structures of your tooth is called the periodontium. So periodontal disease, okay, increases the risk of endocarditis, all right? So probably a person like Dr. Hamza will be dealing with this on a daily basis because every time, okay, regardless of what heart condition it is, all right, every time they go in for a surgery or treatment or anything, they will always send the patients for dental clearance, all right? Why? We have to make sure they have very, very, very low amount of bacteria in the mouth. Why? Because they can travel to other more susceptible area. That means like other abnormal areas. Now that if the person has heart condition, especially valvular heart disease, the valves are not functioning properly. Now these are nicely, like there will be a very nice junction for them to go and sit and probably, just worsen the situation. All right. So dental clearance is very important. So now that's the correlation. All right. So in a rather healthy person, how is it going to affect? So now this is a person with heart condition, existing heart condition. So now if a person who is healthy do not have any underlying heart condition or any other medical condition. So now this having poor oral health and always having increased amount of bacteria and chronic periodontal condition. That means chronic means long term. Okay, anything that's not short term but long term. Okay, just look at this picture. They are just going to destroy your gum, your bone. Okay, your teeth is going to get weak. Okay, and then they are going to enter, the bacteria is going to enter your bloodstream. Okay, we are making it very simple by saying that it's going to enter your bloodstream. But like what I think just now, Kanagese was actually, she actually shared about, what is that, free radicals. See, now that is the cascade of event that we are going to, that takes place here. I think, sorry, yeah, it's. Oh, you're trying to zoom in. Okay. All right. So, yeah, so that's what happens, all right? But that doesn't mean these are very small areas, okay? So our body now, on a daily basis, we are already undergoing there's so much of inflammation already, all right? Just by inhaling poor air, air that has poor air quality, and then the water and all that. We are exposed to so many things, right? And then now you have this. Your body has to fight so much, all right? So now that will increase the risk factor, right? That increases your risk factor to have high cholesterol and other conditions, all right? So it increases the risk factor, but it doesn't directly cause something, okay? So that's a very good paper, by the way, published last year. It was quite recent. It was it's a very detailed, if you really want to know, if you're interested, otherwise, you can actually check for this article, or you can just ask me later, I can share it, all right? So they have actually broken down every heart condition and its relation, basically not relation, but how poor oral health can actually worsen or cause anything, all right? So yeah, this is what I was talking about. The plaque, the bacteria causes inflammation, the triggering immune response for nothing. You have not done anything to your body, but there's, low-grade inflammation that's happening. That's oxidative stress. And then this is the part that's the something that I've not mentioned, that extra one, all right? That platelet activation, all right? So what it does is that all these extra free radicals causes your platelet to be released, and what platelets function is to what? To clot your blood, to clump. So all these extra clumps in your blood, okay, it's on a long term, it's going to narrow your blood vessel. All right. So so it causes endothelial dysfunction. Basically, endothelial is the lining of your blood vessel. Okay, and then causes coronary heart disease. All right. So diabetes and oral health. Okay. So this is a two-way street. Again, just like just now. Okay. It's the same with heart health also. So people with diabetes are more susceptible to infections, including gum disease. And conversely, severe periodontal disease can affect blood sugar control. Okay, to be really, really honest, diabetic patients are one of the, I think, are the challenging patients for us. Why? Because it's very difficult to control their disease progression. Very difficult, okay? So because we can't review them every month, all right? We don't have that, I mean, let it be like government or private, you know, we don't have, we can't do treatment that often as well, okay? We can't disturb that area so much. We cannot clean that often, all right? But once they go back, and then, you know, if they have poor control of, you know, diet, and, you know, if their blood glucose increases and it's not controlled, it's very difficult. It's going to come back to zero, right? So if your family, you know, if you have relatives, or if you have anyone who has diabetes, and please advise them, you know, to actually take care of your oral health very well, because it's very difficult to. So what are we trying to do is, what we usually do is we try to keep them intact. All right. So these are the group of people who are who always have mobile teeth, and they lose their teeth much earlier, all right? So that means if a person is diabetic at the age of as early as 35, the person can easily lose their teeth at 40 or 50, if it's not controlled, if it's poorly controlled, all right? I'm not saying if you have diabetes, you know, you're going to lose your teeth. No. If it's not controlled well, if it's not well taken care of, all right? So, yeah. This is another research that has been done, all right? IDF is International Diabetic Federation, all right? International Diabetic Federation. And so by just looking at this data, you will know that, okay, controlled, uncontrolled, normal glucose level. You will know, can you see, of course, age is a risk factor. That means as you age, you know, with increasing age, definitely you're going to be more prone to have dental problems, you know, oral health problems and all that with age. When you're younger, everything is easy, okay? Right or not? Even you have not realized having gut issues when you're younger, right or not? Yeah, similarly, all right? When you're younger, you don't have this, you know, these issues to deal with. But as you age is definitely a risk factor, all right? Age is risk factor, and then when you have controlled diabetes and when you have uncontrolled diabetes, there's a huge difference, all right? Okay, so going back to, you know, summarize what we are talking about, the supporting structures of a tooth, all right? That is a very sound normal tooth, and this is when the periodontal structures are compromised. So we call it periodontitis. Anything with itis is inflammation. Yeah, so periodontitis, gingivitis, gingiva, the gum. Yeah, so it starts with gingivitis, and it progresses to periodontitis the moment the bone is involved, when there's bone loss. Okay? All right. So, yeah. So the health and the disease part, and this is what actually happens near your microscopically, all right? There's a lot of bacteria that lives around these areas. A lot. Okay? All right, I'll come to why they've actually asked us to brush twice daily. All right? So the basics of oral health care. Okay, let's get to what we can do. Okay, we have spoken about what can happen to us. All right, let's prevent it. Okay? So twice daily brushing, fluoridated toothpaste, choosing the right toothbrush again. okay, flossing, mouthwash, and other oral care aids like mouth spray. Okay, this I think all of us know already. Okay, we are in the business, we already know. Okay, what are the basics? Okay, but why glister, right? I want to just wrap things around this as well, right? Because as a dentist, okay, what we commonly encounter is we always go for products which are well researched. Why? Because when we talk about, just now going back earlier, when we talk about facts and all that, we always go back to journals and well researched facts, right? So when we're trying to combat something or we're trying to come up with a solution, we need products that actually work. Because I tell you, it's not easy to control at these very small areas, bacteria at this small region, okay? Just like how it takes a lot of effort for you to reverse your gut bacteria, right? From the bad bacteria to increase your good bacteria. Similarly, okay? Bacteria are no joke, okay? They are very tiny, they're very small, cannot be seen, but they cause a lot of damage, all right? So, and they're safe, gentle, proven. Last time, those days, many dental products used to have alcohol in it, all right? Yeah, many. And then slowly, they started formulating products without alcohol, all right? So glister is one of them as well, all right? And what I like about it, another thing is like, how many of us have actually seen advertisements with bunga cengkeh last time? You know, that thing will go inside the tube and then, I think it was the C brand advertisement, right? Yeah. So we already know that plant-based ingredients are very good. All right. So that's another reason why, I really like glister, right? So, and peppermint, yeah, most of the dental products have peppermint for the freshness. And yeah, I'm going to talk about a little bit about every oral care aids, okay? All right, so multi-action toothbrush, all right? So we have soft and medium and okay. What is the most important thing that I want to mention here is, so do you all know that there's a tongue cleaner behind? Pandai, okay. Are you all using? Must use, okay. But it's not just designed for nothing, okay? So must use at least once daily, all right? Anything that you do extra, okay, it should be at night. Why? Because you have eaten the whole day and they have accumulated all this, and then before you go to sleep, you have to brush. Okay, can someone tell me why? Why before you go to sleep? Alamak, sorry, but no hadiah. Okay, all right, okay. So the reason why we have to brush before we sleep is because when we sleep, okay, when the body is at rest, is when there are so many things happening, there are so many other things happening like repair, there are so many other processes, blah, blah, blah. And these bacteria are also very active at night, all right? And especially when we are resting, and there's no movement, right? There's no cleansing activity, there's nothing. So it's very nicely sitting there, like accumulating, and then they're producing more and more of the same members, in the same place, and nothing is happening, no movement, right? So that's why it's very important to not let any food debris to stay, on the surfaces, all right? So electronic toothbrush. I actually prepared this some time back because I felt like, we dentists feel like electronic toothbrush is a very good adjunct or sometimes can be a good replacement, all right? And then it's a very good, it really helped me with my presentation today because we already have our electronic toothbrush, right? So I'll keep this for the last, okay, for the end part of my presentation, all right? So why, if you don't know why an electronic toothbrush is better than a manual toothbrush, I'm here to tell you, all right? Because of the rotating and the oscillating head, all right? That vibration. Can you do it on your own? Can you sit there? I know so many of my patients who have actually admitted saying that some of them just sleep off while brushing their teeth. Okay, and that's happened to most of us also, okay? So how's the efficacy of brushing, with manual toothbrushes? It's very, very low compared to electronic toothbrush, Okay, electronic toothbrush, you can actually be lazy and put it there and you do that work. But of course, you also have to move around, okay? Yeah. So, yes, so it doesn't rely on your brushing motion. And the most difficult, another problem, okay, another common dental problem that we encounter is this attrition, abrasion, and erosion. Okay, basically all these three things are related to surface degradation. Okay, one of the reason is because patients overbrush. Okay, overbrush. You're not supposed to use, thank God Glister, okay, has no, okay, I mean, Glister again, they will never come up with a hard bristle toothbrush because they know it's not the right one, right? So you should either use soft or bristle, and if you have periodontal condition, you're supposed to only use soft, okay? So all this extra pressure will slowly, enamel is the hardest structure, and then it still goes through so much of damage, I don't know how, right? And then so the efficacy against plaque and teeth stain, all right? So it's more effective at removing plaque because of the vibration and the motion and all that. So they have a 11-year cohort study on it, and by Journal of Clinical Periodontology, they are one of the leading research, I would say, group of people, right? So, and yeah, more efficient at removing stain because of that vibration, all right? The same thing what your dentist does, not exactly the same, but they can mimic close to what scaling does to a certain extent, all right? And yeah, so since we have, you can customize because they have different settings and modes and all that, all right? So for sensitive teeth, you can actually have the gentler mode, all right? So we can actually be very specific with different people, right? People with different condition, all right? And also, how many of y'all have braces, who's undergoing ortho treatment? All right, so the common problem that we always encounter when people undergo ortho treatment or braces is like their oral hygiene gets compromised because it's very difficult, very, very, very difficult, okay? Cannot blame them. Okay, very difficult. So you need small brush, you need medium brush, you need all that sharp brush, to be that thorough. But with this, it helps a bit, it's better. Okay, so, and they have built-in timers. So now this, I'm going to ask, how many of you all actually brush for 2 minutes? Wow. Very good. Very, very good. I'm very proud, okay? Because I've not seen anyone saying they actually brush for 2 minutes. I'm not kidding. I'm not just saying, but it's the truth, okay? Every time I ask my patient, like, how long do you spend? Because you know why? Every time when someone comes to the clinic and they say, I brush my teeth so well, I brush this, I brush that, but I don't know why I still have this problem, right? But it's impossible to have that problem if everything is right? Yes, so we already know probably this person is not being thorough or just not brushing enough, right? Probably the person, you can brush twice daily, but not enough, not with the right technique, okay? So, and it's cost effective because in the long run, you can actually use electronic toothbrush for a long time, right? You don't have to change, throw, So many people think that electronic toothbrush is actually expensive, but they are not. They are actually cost effective in long term, okay? So yeah, so we have this. I will skip this because I'll explain later. And the toothpaste, all right. So, yep, we have demoed enough, right? We have studied enough. Okay, so I don't think so. What you really have to know is when it comes to toothpaste, is it has to have fluoride in it. Okay, and then yeah, how to brush your teeth. So I brush enough, I brush twice, everything. Okay, so whoever who brushes this way, okay, I didn't open my bruise yet, but never mind, later lah. So whoever brushes this way, okay, I'm not going to ask, okay? Whoever brushes this way, you're doing it wrong, okay? No left and right motion, okay? It should either be circular or up and down. Why? Because it has to actually clean all the way from your gum downwards and your gum upwards, all right? So if you're doing this, you're just basically pushing everything inside, in between your tooth, right? Everything in between your teeth, all the interdental, we call it interdental region, All right. So circular motion, and make sure you can't see what's inside, but please remember that you have to brush inside. Okay? And brush your tongue finally. Okay? And flossing. Okay, this is your floss. All right. So how many of y'all are already flossing? How many of y'all are very good? Okay. So many of us, even I, before I became a dentist, I thought flossing was not necessary. Okay, but flossing is as important as brushing. Right? Flossing. And when do you have to floss twice? No. So anything extra that you do, and you have if you have more things to do, do it at night. Now that is the challenge, because why? People are very sleepy at night, very tired, and they cannot do so many things at night. They just want to be done and go to bed. See, then that's the challenge that we have. But you're supposed to do all this at night. Okay? You're not supposed to leave anything, in your oral cavity. All right? So, yeah. So, yes, do you know that this per container that you can actually use for 166 times? All right? If you're not wasting it lah, tarik panjang-panjang and then waste it, no, that's not the way lah, okay? All right. And then, yeah, so basically how we use is, I just quickly do it for you. Okay, you're supposed to take, okay, this, and then, all right. So you have this metal thing there, right, to cut your floss. Okay, you cut it. Here, okay. Okay. So basically, you loop around one finger, all right? And if you don't want to waste, loop around this finger, loop around this finger, and you go, yeah. Okay, can open. You basically go in between, down, up, down, up. But if you've already used this place, don't use the same spot, okay? Loop again, okay, so that you use a different spot. So each time you go down, so common mistake that people do is they go up and down, up and down, up and down, up and down. Okay? No, don't do that. No, don't do that. All right? Don't do that, because you will eventually push the food debris inside. Okay? You will not remove it. Okay? 100% of the time you will not remove it. Okay? Just once down, and when you remove out, there should be some amount of force. Okay? But again, very difficult to control the force. Thank you. Again, people tend to hurt their gum. Okay? And it's very difficult to actually control the force. Thank you so much. Okay. All right. So what happens is people tend to have bleeding and all that because they can't control the force. Sometimes, overexcited. I think press all the way down, all that. So all these problems are very common. That's why we have water floss. I'm so sorry I've not included how water floss looks like, but I think if you are the kind of person who's like me, who's rushing all the time and do not have time but still wants to get everything done, then you can change to water floss. All right? I'm secretly hoping that, Glister will introduce water floss soon so that I don't have to buy from outside. Okay? So water floss is very effective because it's just like electronic toothbrush. You can charge. You can keep it for a very long time. And you can also do. But I keep this floss with me all the time, because after lunch or something, I can't be carrying my water floss around. So especially if after 25, you realize, don't ask me why, that's another big topic. Usually after certain age, you will experience a lot of food getting lodged in between your teeth. Okay, you would probably not have experienced that when you're younger. All right. Why? Because there's silently there are movements going on, remodeling of your bone. There are a lot of things going on, but it's not something that's that obvious. Okay. So food gets lodged more. All right. And that's why the cavities, as you age, they are formed in between your teeth and not really on top. All right. Okay. So mouthwash, yes, it's alcohol-free, dye-free, and it has peppermint in it. Okay. All right. So, yeah. So this is our. There's a cap here, and do you know that you can actually there's a line inside. Okay, you can mix and everything is very easy to use. Okay. Yes, so 4 pumps for 20 ml, there's a line there. And then for 30 seconds, okay. So whichever area, okay, who has this habit of chewing on one side? Okay, so if can, try to balance, all right? Because if you chew on one side, most likely they are undergoing too much of damage, by because of the chewing forces, all right? And there will be more bacterial living, I'm trying to make it very simple, all right, living over there. And you probably, when you use your mouthwash, try to tilt your head and, try to clean that area more, okay? But that doesn't mean it's normal, okay? You try to balance it out, okay? That means conscious chewing, okay? And use twice a day, once a day also can at night. Mouth spray. Mouth spray is like, you can bring it along, with you, in your bag, all right, anywhere. And like, it's very, very cost effective. 222 pumps, per container, all right? Very, very long lasting. Mine hasn't finished since then, all right? So, yes, so this is the step. Okay, 1, 2, 3, 4. Okay, brush, floss, rinse, and then spray. Dietary modification, paling susah. Right? Right? I thought it's difficult when it comes to kids, but I think it's more difficult with adults. That's what I learned, in the last many years of, talking to patients. So it's very difficult to actually, because they say I need to eat something after when I sleep, when I'm feeling sleepy, when I'm working, I'm like this, I need coffee in between. Yes. I give you a tip. If you have sweet tooth and you need to munch on something, okay, try to include with your meal. That means after lunch, have your snack, like a chocolate or something that you want to have, and be done. Okay, so when your risk factor for cavities increases, when the exposure to sugar increases, that means baru makan lunch, pas 1 jam makan chocolate, after 2 hours order Zeus coffee lagi, okay, which has a lot of sugar, and then after 1 hour, tea time already, it's like 6 o'clock. Before dinner must eat something, not tea time, not anything, but must eat something. And then we eat again, and then traffic jam, you want to munch something. So all this exposure, every time your teeth or the surface gets exposed to sugar, the acid that is released by the bacteria increases, because whether you like sugar or not, but the bacteria loves sugar. All right, they can only live with sugar. So apply the similar concept to your gut health. So you'll know what's happening. All right. So the moment you limit your sugar intake, your gut health will actually reverse a lot better. Okay. So increase high fiber food. Why? Because they have cleansing effect. You can test it out. Okay. You go try to eat guava, something very fibrous. Okay, after a meal or something, you'll feel like, when you put your tongue around, right, you don't feel anything. It's very clean, because the fibers can actually clean the surface, like your brush. Okay? All right, so avoid reduced staining food like your coffee and all that. So tea, coffee, red wine, sodas, all your packaged fruit juices are full with added coloring. All right, your sauces. Turmeric is good, spice powder and all that is good, but if you have gotten whitening done clinically, you have to avoid it, because whitening is not very cheap, okay? So if you want to have longer lasting effect, then avoid this food, okay? Yes, so better teeth for better health, but before we end, okay? All right, okay. Okay, so I want to explain a bit on electronic toothbrush. Okay, all right. So how many of y'all have actually bought this? How many of y'all have started using it? Oh, very good, very good. Okay, so basically, when you open, okay, it comes in a box like this, okay? When you open, it will be wrapped in plastic. I've removed all of them, all right? So you have a very nice manual, very easy to follow, very easy to understand, okay? Something anyone can just read and start using, okay? So basically, why I will tell you about the features first, and then I'll tell you how you can actually talk about it and be very confident that we have the best, okay? Right, so hold on. Okay, so this is the main one lah. Okay, the main person, okay, which is your electronic toothbrush, and this is basically tempat the dock, okay? All right, so and then what's interesting is this thing. All right, so this is the UV sterilizer. Okay, so this is the UV sterilizer, and what I really like about this is, so when you want to sterilize your brush, right, they have a specific way of placing it so that when you place, it directly faces inside, right? You can't place it this way. Yeah, so it's like this, all right? And then when you charge over here, okay? So when you charge per time, it can last you for 70 days, okay? 70 days. And it takes about 16 hours to charge, all right? So, yeah, so this is how it looks like, okay? And then what I like about this is you have like, basically the cable is here, okay? And then you also have like 2 additional head. Okay, so can you share toothbrush with your partner or family members now with electronic toothbrush? Yes, can, because you can use the same electronic device, but you just change the head. That's a trick question. Okay, because you'll not believe it, there are people who share toothbrush. Okay, how I found out is, whenever you go to Tadika, Taska, they are very innocent, they'll actually tell you. So, they cannot hide. So, saya kongsi berus gigi dengan adik saya. So, I'm like, no, you can't. Okay, so you cannot, no, okay? But now you can with electronic toothbrush, okay? So, very cost effective, yes. One device, but 3 people can use actually. And after 3 months, you change the head, okay, the toothbrush head. So, just like I have a best friend that I discussed, this about electronic toothbrush with. My best friend is also your best friend, I'm very sure. Okay. Chapati. So I had a long conversation. Okay, I asked all my questions, and finally this is the summary. Okay, so I also had to go and do my homework and to check if, like, I know there are electronic toothbrushes in the market in Malaysia, but I wanted to know, is it better? What are the features and all that? Okay, so in Malaysia, Glister is the only electric toothbrush which includes both a built-in UV sterilizer and multiple brushing modes. That means it's very important. I forgot to mention about this. There are 5 different modes. Okay, it will lit up, okay, when you actually press. So there's clean, sensitive, gum care, whiten, and tongue. Whiten means like if you know you're drinking too much of coffee, tea, and all that, you just want to prevent stain from accumulating, then you can use. All right. So the others, I cannot mention. Okay. So it's sorry, it's very common. Okay. How do I mention? You know the brand O? Okay. So like that, they have one in Malaysia. So that's like with the highest spec so far. But that doesn't have, they don't have 5 modes. All right, and they don't have a built-in UV sterilizer. Okay, one has 7 modes, but they don't have, the highest spec has 7 modes, but they don't have UV sterilizer. All right, so all this UV sterilizer comes as a separate unit for you to put the brush, and you can also put your manual toothbrush, your normal toothbrush, and sterilize. Like we had our PWP last time, yes, that. But they don't have inbuilt sterilizer, okay? But globally, yes, we have. But in Malaysia, no. All right, so we should be very proud that Glycer is. Please give Glycer a big round of applause. Okay? Yep. So that's all. Thank you so much.
Wow, wow, wow. What a very intuitive session. Correct, right, guys? Woo! Louder, louder. Woo! All right, so I want to ask now, how do you brush your teeth now? Jangan left to right anymore. Now make sure circular and up and down. Kalau nanti, Dr. Vidya marah nanti. All right, give a